I would hate for you to leave tonight and not be aware of some of the services and things that are available to you with NETS in WA. So we all know the list of symptoms is huge. Sometimes people have no symptoms, and that can be really tricky too. If you don't get symptoms, do I really have this? Can I trust my body? How will I know if things are getting worse? But also, just wanted to let you know some statistics that were drawn out of a really major international study that told us what I was talking in the foyer with lots of people about, just before the forum, which is most patients with NETS see 6 to 7 healthcare professionals over 14 visits before they get a diagnosis. Often people have been waiting and searching and under investigation between 5 and 7 years before they find out actually what's wrong with them. And we know that over 50% of people have disease, neuroendocrine tumours elsewhere in their body from where it started when they're diagnosed. A lot of people are misdiagnosed, and again I was talking to a bunch of people out in the foyer before, and just, who's had menopause and who's had anxiety and who's had asthma and who's gone gluten-free, and probably if I get you to do a show of hands, most of you will have had a diagnosis other than neuroendocrine tumours that would have been hopefully trying to explain your symptoms before you were diagnosed. And that means that there's some issues, some common issues in NETS, and certainly that a delayed diagnosis, we know that people have got a lot of symptoms, but then there's this disparity around location. If you live in a rural area, it's very difficult to get in for treatment, and there's a lot extra out-of-pocket costs. Variation between healthcare services and the psychosocial impact, which I think James really talked about very nicely. But it can make you feel very isolated, and I guess the bridge can feel very wobbly, the way forward can feel very uncertain, and it can feel like you're navigating it all on your own. And so I think I just wanted to talk to you very, very briefly about the Unicorn Foundation, and I guess some of the ways that we want to help people feel a little bit less alone, because James talked about at the very end of that spectrum of distress where, if someone's got a really complex mental health concern, then yes, seeing a clinical psychologist under a mental health care plan's got, certainly huge benefits. But there's I think in that middle ground a role for support. So our mission at the Unicorn Foundation is to assist and support people affected by NETS, to improve access to investigations and treatments, to raise awareness amongst health professionals and also the general public, and also to support research and doing things like funding clinical trials. So I just wanted to really briefly tell you about mostly what I do, but with the Unicorn Foundation. So most of you know me. My number's on the screen and my email address is on the screen. So I feel really fortunate to have so many people all around Australia that I get to talk to. And I learn so much about neuroendocrine tumours, which I'm then able to pass on to others. But you're always welcome to give me a call. Peer support is a really important thing. There's only so much that I can say, what you're going through is really normal. A lot of people tell me that they feel like this. But it's also around connecting with other people, and I was talking to someone earlier and just saying how great it is to be able to be in a space like this and know that you're not the only one going through this. Other people are experiencing the similar kinds of issues, and that's really important. And peer support comes in a variety of ways, but a new one that you might not have heard about because it's just recently been launched, and that is a Cancer Connect program. So this is a collaboration between the cancer councils, where we've trained some volunteers who have neuroendocrine tumours, and these are patients, most of them are current neuroendocrine tumour patients, so they're people with metastatic disease who are having somatostatin analogues and PRRT and everolimus and all of the other treatments, but they've had peer support training in how to share their story in a way that hopefully will be helpful for you as the person going through the illness. So that's available, and either via contacting me or via contacting the 13 11 20 Cancer Council line. But you wanted to just draw your attention to that because that's new. But of course, the other way of linking with people who've gone through it is to link in with the support group, and I couldn't recommend that highly enough. Also, information in the form of forums and webinars. The webinars all go onto our YouTube channel. It's worth having a look at that channel because we also do put up presentations from support groups. So Bill actually came to our Perth support group at the end of last year and gave a great presentation, which Melissa sat there with her phone and videoed that, and I've had a number of very violent arguments with my computer, but I managed to get it up on YouTube last week. So it's worthwhile having a look at that. I mean, there was a really great presentation from a pharmacist at the end of last year at our Melbourne group. That presentation's on the YouTube channel too. So if you can't get physically to a support group, sometimes even accessing the information that way can be good. Cancer Council provide financial advice. We also have a financial advisory service, so it's great that sometimes you've got a choice. I know that the Cancer Council one's means tested and ours is not, so if there's an advantage there, then go for it. But also, just wanted to mention our work in advocacy, and we've actually got, since I was here last, we've developed a consumer advisory group, and that consists of members from all states, who are people who are living with neuroendocrine tumours or who have experienced a neuroendocrine tumour within their family, who help us really determine the best ways of working as an organisation. They also do things like lobby members of parliament for increased funding, and one of the things that we're really very pleased about is increased rebates for PET scans, which is about to come in, and also some new developments in terms of community prescription for lanreotide that will be able to get GPs to do that within the community rather than having to have patients come to their oncologist every single time they need a new prescription, and that will be under the guidance of an oncologist. But that's just a couple of examples of the advocacy work that we've been doing. And also working within health professionals. So one of the things that I've been talking to Sandra from the Cancer Council about is running a webinar for GPs. We know that health professionals have a huge learning need with neuroendocrine tumours, and we're working hard to improve that level of knowledge. So contact details are on the screen. I'm going to actually hand over to Sandra from the Cancer Council, who's going to tell us a little bit about services more local to Western Australia, and we're really very grateful to the Cancer Council. You know, they've collaborated with us tonight in running this forum, but in every state, you know, the Cancer Council really form the hub of the local support and information and services for people with cancer. So we can't emphasise enough the importance of linking in with them at a local level. And, you know, we'll carry the flag for neuroendocrine tumours nationally. But on to Sandra. So thank you for listening to my little blurb. But here's Sandra, and I'm going to give you this microphone, and you can talk into that one. Perfect.
Thank you. Hi everyone. Thank you, Kate. As Kate mentioned, and also James mentioned, some of the services that Cancer Council provide. I am the GP Education Coordinator at Cancer Council, so I'm going to be reading from my page to make sure that I don't miss anything off. So I didn't put any slides up. As everyone was coming through the registration, I handed out some of our bookmarks, the Cancer Council bookmarks, and that's got all of the all of the support services listed on there. So I'll just give you a bit of information about those services. The most important number is 131120. You call through that number, you get to speak to one of our cancer support nurses. They can help direct you to any of the other services that Cancer Council provide, or external services that might be more appropriate to your needs. The staff are there through business hours, Monday to Friday. Happy to speak to you at any time, and just put that number in your phone, have it there ready to go whenever you need some help or advice or support along the way. We have a dietetic service where you can speak to a dietitian about diet going into cancer treatment, throughout cancer treatment, after cancer treatment. Again, you contact the cancer nurses and they'll help you direct through to that service. There are so many resources on our website, lots of brochures that you can download, flyers, information for yourselves, information for health professionals, your family. Hundreds probably of resources on there that you can access. There's the Life Now exercise programme, which covers yoga, mindfulness, which James mentioned earlier, and meditation. And those programmes run across Perth in different suburbs. Some of those the programme is available on the registration desk if you didn't pick that up on the way through, if you're interested, and all that information is on the Cancer Council website. There's Healthy Living After Cancer, again, which is about encouraging exercise and being active after your cancer treatment. There are regional support services, so if you live outside of the metropolitan area, we have cancer support officers in the regions, and they can help you with local access to support. And again, if you live outside of the metropolitan area, we have the lodges which you can stay in for your cancer treatment. So if you have to travel to Perth to receive your treatment, there is accommodation at those lodges that can assist patients with that, relieve some of the financial pressure of having to pay for accommodation and travelling and as you're coming through. There are counselling services, which again James touched on. If you call through to the 13 11 20 nurses, they'll help you determine if that's the best thing for you and refer you on to that service. There are education programmes that we have every month or every couple of months, and they're normally in the library, the State Library, where we have an expert speaker deliver a topic to the public about an update in treatment or a new breakthrough or trials that are ongoing. So they are always advertised on the website and open to anyone, so we encourage you to come along to those. We have the WIG service, financial and practical support, legal and financial support. The legal and financial and employment support, those are means tested, like Kate did mention, so there are some criteria to accessing those services. And the other things we have are support groups, cancer support groups and peer support groups, which again Kate touched on, that are available through the Unicorn Foundation, which are always very, very well received, and they seem to be really beneficial for cancer patients on their journey and their families and those that are supporting them. So I think that covers everything that we offer. Again, there's a lot of flyers and information that I brought along that you can grab on your way out. So yeah, thank you.
Fantastic, thank you, Sandra.
Thank you.
Thank you. I know you're all really keen to get going, so I won't take up much more of your time, but just to draw your attention, we've got some Unicorn Foundation booklets at the front desk. You probably will have seen the patients and carers one. This one's for healthcare professionals, and a lot of people do take these to give to their doctors, their GPs, so worth grabbing one of these on the way out. If there's none left, let me know and I can send you one out. We've also got this newer one, which is nutrition and neuroendocrine tumours. So this is some really good basic information. Doesn't involve cutting out major food groups and losing lots of weight, David, you'll be happy to know. So just feel free to grab those. So yeah, look, thank you once again, everybody, for coming. I'd like to thank our speakers once again, and also our videography person my expert brother up the back with the video camera. Thank you, Doug. Love your work. Thanks, everybody.